as you said, I'm going to go through an in-depth outbreak investigation of PED, but I hope that you can take away some other points that these investigations can apply to whether it's Seneca Valley virus introduction into a herd, influenza, or PERS. The checklists are very similar. So when you begin an outbreak investigation, I would start with reviewing the checklist that's been established, and start with a preliminary report. If it's somebody outside of your system, like in my case, it helps to get an understanding or a feel for what their system looks like. A map of the production area can also be helpful, especially when you're unfamiliar with that. And then a brief conference call prior to the face-to-face. And then schedule that face-to-face interview with the herd veterinarian, the production area, or the farm staff. And then follow up with a report where you can put your conclusions and summarize, especially when you're reporting back to maybe an outside owner, a CEO type, or in my case of myself, back to the USDA. And so the charge really should be to the records, to the reports. And some are more neatly stacked than others, are easier to find. And you may often find that some things that you would have liked to have seen documented are actually not there at all. So in this case, the preliminary report was an acute PED outbreak on Wednesday, April 1st in 2015. It started in Unit 1. The laboratory did confirm the original strain of PED, and all clinical signs started in the farrowing house, and as it moved through this production system, those first clinical signs were in the farrowing house. The health status was PERS LVI of off-site replacement gilts, so they had a serum homogenate that they had frozen, and the herd vet himself would thaw that out and take that to the replacement gilt site, finisher site, and have them inoculate the gilts there. Mycoplasma vaccinated herd, but otherwise stable, no clinical activity, APP negative, and had been PED negative up until this point. So they had missed a lot of the epidemic levels through 2013 and 2014 and thought that they had done pretty good on their biosecurity, so this was somewhat of a shock to them. So once we got this initial information circulated via email, we had a conference call with myself and the USDA investigators. More information then was provided. This production system consisted of 9 units, 1 internal multiplier, 1 nursery, 1 gilt developer unit, 5 farrow to wean barns, and then 1 finisher. A lot of these pigs were sold to outside clients through wean pig agreements. It was a parity segregated system. Gilts were bred and farrowed at Unit 1 and then moved as sows to other farms. It operated its own feed mill, had farm dedicated trailers, and an internal truck wash as well. So everything that you would think that would have helped with good biosecurity. And so we did actually in our report include Google Maps, but for the sake of this presentation I wanted some anonymity, so this is a basic schematic of how their units laid out. So distance from, let's see if I can get Unit 3 up here to Unit 4, kind of the edge of their system, is about 6 miles. So these herds were all contained in a very close proximity to one another. All employees, including the farms and the feed mills, would use an exchange site. The employees would change from street clothing into provided clothing. Food items were exchanged into plastic bags, and the personnel would leave their own vehicles in a dedicated parking lot and take farm vehicles out to each unit. So again, thinking that this would play a better role in keeping anything that had not reached these units off these sites by putting more space or more layers between them and their street clothing and vehicles. And so this would be the Rapid Response Outbreak Investigation form that was sent to me by the USDA. I believe Dr. Dale Holtkamp had some hand in developing this as well, and just created a checklist for us to make sure that we covered while we were on our investigation. And then this was also what I used then for the outline of my report back to the USDA. And then the herd veterinarian as well was also copied on that. So the acute PD outbreak started in Unit 1, and then it moved on Priority 1 sows to 2 other units. The other thing to note was that multiplier unit was internally multiplied, and no animals left that site or came onto that site, and it remained PED negative through this time, but was supplied by the same feed mill. So what did they do differently that the other units weren't doing, and that we saw that spread through? So we started going through the checklist. We collected all the data in regards to swine movements, vehicle deliveries, personnel movements, manure removal, entries of other animals such as pests, air, and water. We then scheduled a meeting with the herd office, and I'd say try to schedule these as close as you can to the actual outbreak. Memories change over time. People forget, especially when that information isn't written down. So this was about the 23rd of April that we were there, so within the same month. And I'd say if you could get that even closer, that would be more ideal. We did tour the production area, but we didn't shower into any of the actual farms, and we did tour the feed mill as well. And then after that, we sat down with the production members that would have been interacting with these farms, maybe on a more intimate level than the herd veterinarian himself. And as I summarized the information, then it did seem through the animal movement information that was collected that had likely moved PED to at least 2 other units. One of the things that we had found, though, was those animals were non-clinical, and they were gestating animals that were moved or after they had weaned, but certainly there was enough either manure on their hooves or they were still shedding, even though non-clinical, to move that virus around. Mortalities were collected at a central location for disposal, but they weren't actually using rendering, so that could have been a factor. And then issues at the exchange site with vehicle usage. So while they had thought that they had assigned vehicles to every farms on the weekends, they would use whatever vehicles were available. Some employees would start a little bit later. They might use the maintenance person's vehicle and did not quite have that separation that they initially thought. So gremlins do work their way into systems over time. And that was something that we didn't learn from the herd vet, but actually from the production managers as we asked, well, you know, are these vehicles actually dedicated? He said, well, they're supposed to be, but I noticed this weekend when I drove by that even my vehicle was gone, and they're not supposed to use that. So you do find things like that. And we also, the location of the exchange site may not have been ideal. It was located directly across the road from Unit 1 where the initial outbreak had occurred. And then people movement within the exchange site itself may have also helped to spread PED through the system. Maintenance equipment is kept separate for each unit, but we did find that they had a couple real-time ultrasounds that they moved between each one of the farrow to wean sites, and it was cleaned and disinfected, but nobody really monitored that process, nor did they log where the ultrasound had gone from unit to unit. So I saw that as a possible way that we could have moved PED through that unit if it wasn't properly cleaned. In review of the feed mill, they did have birds throughout the feed mill. But overall, the biosecurity procedures were good. All the ingredients came from local, and they had the rule that only on bluebird days. So for them, that meant like this picture here, it had to be sunny out, not raining, not sleeting, not snowing, and that material was then dropped into, actually augured overhead. They did not have a pit drop either, but they were very clear that if anybody was emptying out a grain bin and it was raining, they would have to wait until the next day. They did own their own feed trucks, and delivery of feed ingredients was done to a box truck and then held for 30 days prior to use. No animal products were used in feed, and no Asian source trace minerals were used. They did have a dedicated truck wash, a transfer station for cull sows and wean pigs. So for some of those pigs that were sold and not going to their own finisher, they would back up, have a separate chute, and then load it onto a transport for hire and take those off site. So there was no direct backing up of a site of a truck not in their system to one of their sites. Manure removal was done by the production system employees, and equipment was owned by the employees, but again, it could move throughout those systems and was not necessarily well logged. A lot of that was the production system manager's memory. Birds did have access to the feed mill, and several of the older farrow to wean units as well. As we drove around, we could see older style barns that would allow birds to have access. One of the things they also had told us that prior to our arrival there was migratory fowl, snow geese and Canada geese populations in fields surrounding the farms. Did actually reach out to the wildlife division of the USDA and walk that field looking for samples to collect. Unfortunately, it had been tilled right before that, So the timeliness of this investigation, if it had been done maybe a week before, we may have been able to grab more samples of bird manure or even collect some birds themselves and swab them for PED that we lost the opportunity to do because of the timing and because just of the nature of getting ready to plant that field had already been tilled. The units were not filtered, and water source from the farm was individual wells, so we didn't feel that was necessarily a source of contamination of the waterfowl, the migratory fowl actually landing on the ponds themselves and feeding in. So conclusions that then came from that was that based on some work that we had done within the Carthage system on environmental swabs that we had collected through the fall of 2013, we were actually looking for PERS, but found that these swabs were as well to be tested for PED, that the shower areas and the foyer areas of the farms would actually become positive 3 days before clinical signs were exhibited by the animals, so this would be clinical diarrhea within the barns. So that actually moved our investigation back additional 3 days. So we know there's about a 3-day incubation period. So we're actually looking for 6 days back from when we saw the introduction or saw the clinical signs of diarrhea. So sometime between March 25th and the 29th was my conclusion that the virus entered the Unit 1. However, and I think this morning's speaker pointed out that we don't always know how these viruses move around. So when Linda Safe said they don't know how the variant strain got back into the European Union, it made me feel a little bit better because I was not able to determine how that Unit 1 first became infected. But I did feel that after that, we could tell how it moved around in the system through animal movements and things like that. So still frustrating on these projects that you don't always find the smoking gun. There was a propane delivery to Unit 1 on March 27th, but that was the only delivery or outside personnel that fit. However, the production team did have an excellent biosecurity in line for them. They had actually made that propane truck wash at the one of the on-site manager's homes located about 2 miles away from this site and on the edge of the production system, so that truck wasn't even allowed to really roll into that area until it had been cleaned. Most likely explanation how PD moved from what they had called Unit 27 into Unit 28, which are farrow to wean facilities, was due to movement on April 1st. So they saw the clinical signs that afternoon and called the production manager, but that morning they had already moved sows. So even though the clinical signs started in farrowing, these weren't clinical animals. They had enough virus that I believe moved with them. And then the dedicated use of production system farm vehicles to units appeared questionable, especially over the weekends. And if you swab things after a PED outbreak, like a cell phone item, which we had actually done after our first outbreak, one of the first things that vets and production managers do when we jump back into our vehicles is we check in with the office, we pick up our cell phones, we check emails. We're actually finding virus. Now, of course, we can't tell if that's live virus, but it's certainly concerning. So you have people at the end of the day going from farms that don't know they're shedding to a central location and going back out. So for me, that was certainly concerning that even though we thought we were protecting them from incoming viruses or bacteria in that exchange site, maybe it actually became a contamination point for the rest of the system as they all went back to that point at the end of the day, changed out of their farm clothes, which would be come in contact, laundered together, and then would exit that the next morning. And there'd be about 3 days. I think the second speaker this morning, Dr. Carla, said that with the high-path avian influenza, there was a lag time in when they would go positive and when the clinical signs would actually develop, and that's very much the case for PED as well. So there were some points that they were operating that they didn't know they could be bringing back virus to that exchange site. The maintenance equipment did seem to have good biosecurity there, was not permitted to share between the units, but the real-time ultrasound was, and that was not logged. So it could have been a fomite, and without that tracking log, we really couldn't tell where that had been in relationship to the other units as they broke in the system. And then lastly, we stopped and said, okay, well, how does Unit 4 different from all these other sites, and what decreased its risk of PED exposure? Well, the first thing that I noticed as I was doing the farm tour that I wouldn't have noticed from an office was that there was no off-site garbage, there was no on-site garbage dumpster for pickup. So the trash receptacle was actually located at another site, so they would drive to that site and throw away, and they didn't have a lot of garbage. It was a smaller farm, about 400 sows on this site compared to some of the others. They actually didn't use one of the ingredients that we thought was a concern, later tested and found to be PED negative. They didn't have any of the PERS live virus inoculation material, which we did test that for PED to make sure somehow along the lines it hadn't become contaminated, and it was negative. But at the time of putting together the report before those results were back, that was certainly significant. It was actually maintained as a PERS negative site. There was no gilt introduction. One of the ways that we definitely saw that the virus moved around the system was through animal movements, so the animals were born there, raised there. And a low human impact. Only 2 employees that were related and lived in the same house worked on that site. And these 2 employees did not go through the exchange site. They were permitted to drive their vehicle directly to the site, and so they had that separation there as well. The garbage dumpster pickup became significant later when we asked if they had routed those delivery pickups a certain way to make sure that they started at the cleanest site, and they hadn't. We found out that the garbage actually was picked up at another site outside of their production system that did have swine on it before coming within their system. So that was something they were able to correct following our initial review, but not something they had picked up on their own prior to us coming through. So with that, and certainly we don't have all the answers, but I think as an industry, if we come together and we start doing an analysis like this on every herd, we look at the same things and we start compiling our data, we have an opportunity to try and figure out what the similarities are and what the differences are and if those are significant or not.